what is the importance of being active listeners, and how can we make patients feel heard and still have a timely session? Because I think that's the challenge between them. Give them the treatment they deserved, listen to them, but we also have to see all the patients that get scheduled in the clinic for us. So I think that's a very difficult challenge.
Well, yes. And so what I would say is, there are some important aspects to effective communication, and you used the word active listening. So, and I think you hit it right on the head. So what is it that makes an active listener? So I'll give you an example here. So if you're in a conversation with somebody, many times what we do, instead of listening to what the person is saying, we're trying to formulate our next thought. So we're not actively listening to what the person is saying. We're trying to think about what we're saying. In order to be an active listener, you actually get the thought out that, okay, I'm not going to formulate what I'm thinking right now, but I'm actually going to hear what the person is saying, because hearing and listening are two very different things. My mother-in-law, when she was alive, salt of the earth, and she had these wonderful pearls of wisdom. And one of her pearls of wisdom was, Todd, we have 2 ears and 1 mouth, and that's probably a good ratio. So
it's true.
So I think, it leads right into your question of how do we give patients time without them feeling rushed or as though they're not being listened to. And I think you and a lot of your listeners probably know that when a person is sitting in front of them, the likelihood is, if they've gone through the healthcare system, that they've not really been listened to. And if you can allow that person to know that you are going to listen to them, that's huge. You've got them to buy in. So how do you do that? Well, one thing that you can do is you can tell them, look, I am going to ask you a lot of questions. And if at the end you feel there's more information I need to have, I'm going to need you to tell me that. Because generally what happens is, if the person thinks that they've got their obligatory 5 or 7 minutes with you, they're going to want to tell you everything, whether it's going to help you determine what the problem is or not.